Okay, going to the doctor or having any medical procedure can be pretty stressful for anyone.
So true, but that's especially true for children, and there are things we can do to help. Joining us now is Dr. Jill Pineda, a clinical psychologist at MGH. Dr. Pineda, thank you so much for being with us this morning. Let's start with a little bit of advice for people of any age. What are some things we can do before a medical procedure to ease anxiety?
Absolutely. Thanks so much for having me. I would start with making a plan ahead of time. Think about bringing a support person that can help you feel comfortable, and find out more about the procedure. What's involved? How long is it? What do you have to tolerate? Really understanding what's going to happen can help you make a plan and advocate for what you need. I would also highly recommend bringing distractions that you can use during while you're waiting in a waiting room or during a medical visit. As we know, distraction is one of the #1 tools to decrease anxiety around medical procedures. Really, basically, use strategies that can help you minimize your worried thoughts. So talk to a loved one, look at pictures on your phone, watch a video. All of those things can be really helpful.
Okay, if you're a parent talking to kids specifically, how can a parent help calm their fears? Anyone who's ever taken a child just to get shots knows it's not easy.
Yeah, absolutely. I would say the first place to start is to talk about it. Be honest about what to expect. One of the worst things you can do is to make it a surprise. So talk about the shot or procedure that's coming up. Don't say things like it won't hurt. You might say it'll be a brief pinch or pain, but I'll be there to support you and it'll be over quickly. Offer choices like, do you want it in your left arm or your right arm? And offer motivation. Offer a special reward or activity for when it's done.
A lollipop at the end always goes a long way if there's a shot involved in a doctor's appointment. You work with the Lurie Center for Autism. If you have a child with special needs or an adult in your life who is on the autism spectrum, how can you make medical appointments and procedures easier for them?
Absolutely. This is so important. We know adults with autism and other developmental disabilities have less access to medical care, longer visits, and are less likely to complete preventative health screenings, which are so important. And this really honestly has to be a collaboration between patients, caregivers, and medical providers. But I would say first, support communication. So whether someone uses spoken language or a communication device, it's really important to understand their needs and take time to communicate both what they're going to experience and allow them to communicate. I think most of all, what we know is an approach called systematic desensitization, which involves basically gradual practice or exposure to parts of a medical procedure that someone might experience, can be very, very effective in decreasing anxiety. It might take a little bit of extra work up front, but this is really a long-term solution to minimize the need for restraint, sedation, or anesthesia.
Okay, I think you're making a lot of people feel better before they even get to the doctor. Thank you, Dr. Jill Pineda, a clinical psychologist at Mass General Hospital. Have a good weekend.
Thank you so much. Thanks for having me.